Hi guys. Okay, so this video is about orientation, and this is orientation at a hospital. The first orientation you will have is the classroom orientation, and that usually depends on the hospital, the information that they give you. They'll give you a folder with all of these papers and packets and stuff in it, and what they do is just go through it. What they are big on talking about is the HIPAA laws, about using the computer, about what sites not to go on. Not only using the computer, because a lot of sites are blocked, but about using your phone on their network, because a lot of people have gotten fired by watching porn on their phone and, going to certain sites that are, forbidden. So they talk about that. They talk about social media. Social media is really big. They're going to spend a bulk of time on social media because a lot of people, again, are getting fired because of what they are posting on social media. So you're going to be sitting and listening to a lot of that. You're going to also probably watch videos about patient safety and employee safety, about using your badges, like not letting people use your badge to get into doors or into the computer, or even to get into the hospital when the hospital is closed, or using certain doors that only employees are allowed to go through. If someone is behind you, you're not supposed to let them come in on your badge. So they'll talk about things like that. They'll talk about what can I remember? You'll meet like the CEO of the company. You'll meet a lot of people. They'll have them all lined up to introduce themselves and what they do, like managers of units and floors and directors and people like that. So you'll get to meet your manager and your director depending on what unit or floor you're on. You'll know, like the head of environmental services, the head of the food service and things like that. You'll know the head of security. You'll know all their faces. You might not remember them or their names, but they'll introduce themselves to you. So that's going to take like about an hour and a half of people going on about themselves. And then you will probably break and have lunch, and then it's back to hospital procedures and policies, which there are a lot. And it's about 8 hours, and you get paid for it, of course. And they will give you your badge, and then they will teach you how to use your badge, how to swipe for like the time clock thing, how to swipe that, and how to use your badge to get into doors. They will tell you what's on your badge, because on your badge you have like a lot of other things on your badge, a lot of like information, like little short cards of information. You'll go through all of that. Like you'll have a code card on your badge and tells you what all the codes are. Then you'll have some safety one where it kind of reminds you what to do when there is a fire. What else? And things like that. You'll probably be asked to introduce yourself and where you're going to work and what do you do. That's usually the first thing that you do when you get in there. That cheesy part that we all hate. I think that's about it. So it's just hospital procedures and information. They'll tell you about passwords, like they'll give you instructions on whatever system that you're using in the hospital for patient information and how to get into it. You'll get like a sheet, how to put your password in, how to set up the password, you know, all that. Everything that you have to know to function in your job, with your systems, with your equipment, all of that, you will know on that day. And then you have the floor orientation. Oh, did I tell you there's another big one, well, in my hospital, that they're really cracking down on, and that is uniforms and how you present yourself. They are really cracking down on scrubs and how they fit the employee. A lot of people are being sent home because their scrubs are too tight, especially women. It's mostly women. It's not really men. It's the women. They're being sent home because their scrubs are too tight. And if you think about it, because I had a pair of scrubs that were getting too tight, and it was a struggle just trying to put the shirt on. I mean, I'm fighting, trying to get my arm in. It's like, you know, it looks cute and everything once it's on, but to fight with my clothes to put it on, it's like, really? And then, you know, it's kind of restrictive. So, you know, I stopped wearing it because it's uncomfortable. But to think, doing the job that I do, as much movement that I have to move in the scrubs, you know, it's not efficient for me to wear tight scrubs. And a lot of people wear tight scrubs for many reasons. Some maybe just want to show their shape. Some just don't want to, you know, come to the realization that they need a size bigger. You know, I don't know what the reason is, but they're cracking down on scrubs. So if you are buying scrubs, don't get scrubs that fit just right, you know, that are tight and you can see every crack and crevice and lines, you know, in your pants when you walk. And if you have to fight to put your shirt on, you know, you need about a size or a size 2 bigger. And, you know, just be comfortable. This is definitely a job, a hospital 12-hour shift. You want to be comfortable. You don't want to be all feeling all tight, looking tight, you know. God forbid if there's a cold and you have to do chest compressions on someone, or if you have to bend down and pick something up and your uniform just burst. You know, that happens to a lot of people because they don't want to get a size that's really suitable for them and for their job so that they can be comfortable. So, yeah. Buy scrubs that are fitting properly. A lot of people at my job are getting sent home because of that. The managers are on the lookout. They will tap you, your scrubs are too tight. They'll give you a warning and come back to work with some tight scrubs. Gotta go home. And it doesn't look professional. What else? Okay, so then you have orientation on the floor. Orientation on the floor, you're paired up with another CNA, and you follow them, you shadow them on your first day. Some people on their first day of orientation, they don't want to do anything, they just want to watch. But on your first day of orientation, with that 12-hour period, it is my suggestion that you do more than just watch. Do something. Go, you know, help and get supplies, do vitals, practice on the machine, because the more you practice, the more confident you are going to be when you're on the floor by yourself. Don't wait until your orientation day is over and you got one more day to try to start doing everything now. Try to start changing a bed. Do it on the first day, because the more experience you get, the more confident and the more sure of yourself you're going to be. Because believe it or not, patients know when you're confident in your job. And they'll ask you, do you know what you're doing? You know, is this your first day? Are you new? They can tell, because there's the confidence level is not there. You're fidgeting, you act like you don't know where to put what to do next. It's just like you look like you're all over the place. You know, someone who knows what they're doing is bam, 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 and they get it done. But those who don't, they're looking for this and looking for that and just looking unsure. You don't want to be that person. So do as much as you can on your orientation days from day one. On day one, sometimes you're not allowed to get in, well, you're not allowed, but not that you're not allowed, but sometimes there's difficulties with your passwords and using your ID and getting into doors, because sometimes they don't activate your badge, and then you have to go to human resources and or give it to your director and then come back and get it for the next shift. So it depends, but if everything is okay and your badge works and you can get into the system, practice charting. Just say, okay, I'm going to chart on these 3 people, so you won't be so overwhelmed, and practice charting. Practice knowing what screens to get into and all of that, and where the information is and what's what. Little shortcuts and stuff like that. Ask the CNA for little shortcuts and things like that, because there are little tricks and stuff that you can do on the computer to get done with your charting quicker. Because we used to press F9 for everything to see everything comes up, but if you know that snack is SN, you just type SN and be done with it. You don't have to go through a million screens. So just practice and do more and be proactive. Don't wait until the aide that's training you tries to give you something to do. Ask if you need help with this and that, or can I do this, or can I do that, so that you can know what to do. Because if some that people that orientate you, if you are not proactive and you're not asking questions and things like that, they'll be silent throughout the whole work shift. They won't give you any information or anything unless you ask. They'll probably tell you this here, this, for this, and this is for that. Oh, and you should do this or that, but it's going to be really limited, and you want as much information as possible. So ask a lot of questions. If you see the CNA doing something that it's not in the book or it's not what you practiced in your CNA class, ask them, why you are doing this, because in the book it says that. Well, don't do that, because CNAs hate that, because you'll find that when you get on the floor, what's in the book is going to be thrown out the window anyway, because it's not realistic and it's not practical. You don't have time for all of that book stuff, because when someone has a BM and it's coming out and shooting out like water, you don't have time to be folding the washcloth and folding things and putting how do they tell you to do it, fold it in 4. Nobody got time for all of that. You're going to pick up that wash rag and you're going to start wiping and throwing the wash rag in the soil utility pan. So you're going to find that a lot of things that you have studied in the CNA class or to be certified, it's thrown out the window. I think that's about it. Just ask as much questions as you can and do as much as you can. Don't be one of those orientees who just sit back and is the yes ma'am and the yes ma'am and the yes sir person, and just sit there and just do nothing and just walk around and follow you while the orientator is doing everything. Don't be that person, because once you get on the floor, you're going to be lost, and you don't want to be lost. You want to know what you're doing. All right, so I hope this answered your questions, and if you have any more, you know where to put them. Bye.